Hi there. People are logging on slowly. I'm Petra. Welcome to the webinar. Hopefully you can hear me. Does everybody mind, just before we get started, hopefully you can see somewhere on your page there's a place that you can write me a question, or me or Faye a question, just to let us know that you can hear us, the volume's okay, and that you can see the screen which says health creation in pregnancy. So if you wouldn't mind just typing a quick hi or hello or yes, I can hear you or something along those lines. Okay, looks like, sorry, I'm not very good at this technology. So, oh, hi. Good. So I thought it came up. Thank you. The next person. Good. It sounds like you can all hear me and you can see the screen. We've got a few more people logging on, so it won't be set. Grab yourselves a cup of tea, herbal tea, and we will then get started. And I've got Faye next to me too, so
Hello.
She's ready as well. So let me just check. Is everybody having a nice night? It's beautiful weather. Has anybody got any questions that they want to type in now before we even get started? And I can just make sure that we're going to cover it. Okay. Actually, some people I haven't heard from. If you can hear me and see the screen, press, if you could type in your question place, hi, can hear you, all fine, or something like what other people have put. There just seems to be a few of you that maybe haven't had a chance to write anything down yet, or it's gone somewhere else and I can't find it. No, that's not it. Yeah, I've got yours. It's just for those that are still logging on, welcome. My name's Petra and I've got Faye next to me as well. And we're just checking if everybody can hear us and see the screen with a pregnant belly and some wheat on it. So if you can find your question space and just write a little message to me to let me know that that's all good. Great, thank you. There's another one. Anybody else? Before we get started, it's yeah, we're only a few minutes over, so don't want you to miss out on stuff. We've got lots to share. Okay, someone else has just logged on. The person's just logged on. Can you just let me know that you can hear me and see the belly on the screen by just finding your question area and maybe just typing a little message to me? Nothing rude. Because I don't know what to suggest if you can't, except maybe turn up your volume on your computer if that's how you're doing it. I'm not sure if any one of you are doing it via phone. I think most people will be doing it via your computer. So let me know that you can hear me and see me, and then we'll probably just get started. So just while you're waiting, just have a little think about where you're at. You know, you might be trying to get pregnant, you might be already pregnant. Just have a little think about what you're wanting to get out of it, and we'll obviously do our very best to fulfill what you're wanting. All right, I think we'll assume everyone can hear us and see us so that we can get started. So welcome, first of all. It's lovely that you've been able to take part in our webinar. You will not be seen and you will not be heard, but the way you can communicate with us is via typing in your questions or your feedback or answering our questions or any other information you would like to pass on to us. So yeah, go ahead and do that. So my name's Petra Jolly. I think I know quite a few of you. I'm an acupuncturist and I've got a clinic, which you'll see there, Newtown Natural Fertility, who specialise in fertility, pregnancy care, and we're doing some babies as well with Faye. And next to me, as I said, I've got Faye Kendall, who's a cranial osteopath. She can maybe introduce herself a little bit more, or do it now.
Yep, that's fine. Hi, I'm Faye. So just wanted to echo what Petra was saying, and thanks for joining us. I'm an osteopath who treats a lot of pregnant ladies and babies. Just area of interest of mine. It's really great to be able to share some knowledge with all of you.
Yeah, so the idea about tonight was to be informative, but also give you ways to create a better pregnancy. I think there's a lot of information out there, and some of it can range from being quite absurd and ridiculous right up to being completely sensible and really great advice. I guess we're just adding to that advice, and what we're really wanting to do is share some of the knowledge we've gathered over, 12 years for me, and probably similar for Faye, of women that we've seen who have been trying to get pregnant, are already pregnant, or post-pregnancy as well, which I'll touch on as well. So it's our intention not only to tell you about conditions, but more so create an environment so that maybe you can avoid those issues. So rather than needing to find a cure, it's always our intention to create a healthier body so that you don't have some of these conditions that come up. So there is so much we could cover tonight, but considering we only have, not even 60 minutes anymore, we needed to make some choices about what would be the most relevant and possibly the most common conditions that we think we can help you with, or that we can come up with ideas of ways that you can avoid it. So we could, do a whole seminar on something like, or webinar on morning sickness, say, and give you advice and prevention. But as it is, we'll just touch on that and cover the most important stuff that we can think of. But there is something that you really want us to cover, by all means, type in and let us know. So if you have any questions or input, please don't think it's a silly question. It will probably help somebody else. Somebody else will probably already have that question, and it's never silly. There's no such thing as a silly question. So I guess, most of you have answered the question, but please tell us, I guess, where you're at. Are you planning a pregnancy and wanting to create the best pregnancy possible? Are you already pregnant, and what stage you're at in the pregnancy? And, tell us maybe just where you're at. So if you could just type in a couple of answers to the question about where you're at. Yeah, so somebody's just typed in that they're planning to get pregnant hopefully in the next sort of 3 to 6 months, which is great. So you'll get a lot out of tonight. Some of you, sorry, I just have to scroll down. They're all flying through. Okay, so one is moving into her second trimester. Another girl is hoping to be pregnant soon and is doing some IVF, which is exciting. So definitely everything that we're going to talk to you about tonight will help, particularly all the nutrition side of things, and then what your options are if something comes up in your pregnancy. So I'm going to break with tradition. What do I do? How do I go to the next slide? Okay, so this is kind of that taboo subject, and it's something that is probably the hardest part about pregnancy, and probably the thing that most women fear the most, yet it is one of the most common things that happen in pregnancy, condition of pregnancy. So some of you most likely have suffered or have know of somebody who's had a miscarriage. The statistics of that are out there is, I think, 1 in 3 or 1 in 4. Please tell me if you think they're different. We feel very privileged in our clinic. When we did our statistics, it was 1 in 16. So it's quite rare in our clinic, but at the same time still quite common, because there's still people that are, every 17th person or 16th person is having a miscarriage. So there is a common misconception that there's nothing you can do about it. So I don't know if any of you have had a miscarriage. By all means, let me know if you have. Some of you have probably had a what's it called? A near miscarriage. There's a proper word for it. So we're always trying to prevent them for you. But the common misconception, I think, that there is nothing you can do about it. There's a lot you can do about it. And certainly if you've had one, and we obviously don't want you to have another one. So there's a lot of talk about prenatal care, which you would have heard about, which for some of you, you'd be on multivitamins, you're probably being careful with your diet, you're probably talking about that. But I want to take it a step further. So you can see from the graph that I've got here what Western medicine have put as causes of miscarriage. So I can't even see that. So I think it's the 50% is, that's covering my screen. How do I move this? Sorry, technology is not my good thing. Lucky I'm good at other things. Oh, good, thanks. Okay, so 50% is unexplained, which is where natural medicine really steps up. 45% of those would be genetic, which we think with a bit of prenatal care we can avoid a lot of those as well, particularly if we're seeing the male as well, because sperm and egg obviously create the baby. 2.5% are immunological, which means that your immune system is kind of overreacting on your body and attacking the embryo, and 2.5% is anatomical or structural. So I guess of those, a percentage would be unavoidable, and I would say a fair percentage of those genetic would be unavoidable. But I would have to say that for the rest, natural medicine actually could avoid a really large proportion of those. So it's really important to know that 3 months of prenatal care, if you can give that to your healthcare practitioner, that gives them an opportunity to balance your hormones before you even go into a pregnancy. Once you are pregnant, we can still help with that. Nutrition is super important. So you would have heard about, all these extra nutrients that you need to nourish a baby. We also need those nutrients in your lining so that when the embryo starts to attach, it's all there ready and waiting so that the building blocks keep going and that embryo continues on. Exercise is always going to help. I don't mean massively running, like crazy and getting your body temperature up, but just mild exercise, 20 to 30 minutes a day. It can be walking, swimming, something that's not too stressful, but it gets the blood moving and it keeps you healthy. It gets your gets your endorphins up, it gets your serotonin going so that you feel good. And then, the right hormones can be firing, because quite often adrenaline and cortisol, which are more your stress hormones, get in the way and they can kind of impede the growth of the pregnancy. So exercise is good, and reducing your stress, just really basic stuff can help, but that's something we would go through. So I think when you're told that there's nothing you can do about miscarriage, I would say absolute rubbish. There is a lot that you can be doing, and really it'd be great if you could. And if you're in the early stage of pregnancy and you are worried about miscarriage, or you've had some bleeding, then, there's things we can do for that as well, whether it be, all the advice that we give you, or whether in fact that you take some of that on yourself and find someone to help you with the hormones. All right. So is it normal to feel different? For those of you that are pregnant already, did you feel pregnant? Did you know you were pregnant before you were told, or was it really obvious in that first few weeks? Can you just give me an idea? Yeah, so some of you are mentioning that, yeah, for sure you felt different, that you had breast tenderness, that what else have we got here? Oh, you felt ill. Yeah, that's a good one. Yeah, so another person said that at 6 weeks, by the time she was 6 weeks, the symptoms really started to kick in. And yes, it is normal to feel different. Of course, so much is going on. You're getting massive hormone shifts, and hormones are responsible for a lot of conditions. So you're getting an increase of progesterone from really early on, which is really important because it thickens your lining and supports the growth of the pregnancy. Oh, minimal symptoms. Okay, that's good. And I felt normal. Oh, that's good. So maybe those, and I know who it is that felt normal, and I'm pretty sure she's a healthcare provider herself and was probably really good with her prenatal care. Am I correct? Yes. So minimal symptoms is great. That's exactly how you should feel. It is normal to feel different, but it's not normal to feel revolting. So lots is going on in the body, massive hormone shifts, lots of extra progesterone. The boobs are changing shape, the belly's changing shape, the uterus is growing from walnut size up to a grapefruit size within the first, well, we say 12 weeks, but it's not actually 12 weeks, is it? Because by the time you find out, you're already 4 weeks. You've got higher blood volume, which brings on certain symptoms. You've got extra nutritional needs. So, you know, you may notice that you feel this overwhelming lethargy. That's probably one of the most common symptoms that I hear in our clinic, that they're just exhausted. And that's because your baby's taking what it needs and it's growing and the lining's growing and, you know, everything's happening so that you do get that overwhelming lethargy. Ligament and tendon relaxation, Faye's going to actually cover that a little bit more than I will at this stage. But certainly as you go on in the pregnancy, as the relaxin hormone kicks in, which is going to allow your baby a passage out of the body and will soften the cervix and, you know, help with the dilation, it can lead to other aches and pains in the body. And also, you know, as you change posture as well, your boobs, as I said, get bigger, but then the belly starts to get bigger, your back starts to curve, and, you know, the breasts start to pull on the neck. So all these things are normal, but they also shouldn't be causing you too much grief, because there's stuff that you can do about it. So, and extra fluid as well. So you might notice that, you know, just physically you're going to get extra fluid, which will nourish the baby and the amniotic fluid and keep that all healthy. But at the same time, you may end up with a bit of edema or swelling around the ankles, and, you know, there's different conditions that are linked to that. You also might get some nasal congestion. That's a common one as well. That would also be coming from that extra fluid that's going through the body. So absolutely 100%. It's normal to feel a bit different, and there's very valid reasons for that, and really it's because it's supporting the baby's growth. And you'll notice from my little picture here, Faye, can you move that out of the way again? I hate this technology. Right, and it says, I don't have a pregnancy brain. That's a ridiculous myth. Now please get me the box of cereal I put in the fridge. Baby brain is actually very, very real, and I did quite a bit. I've done a post on this on our Facebook page, which you may have read, so I hate to double up, that even before a woman gives birth, the pregnancy tinkers quite strongly with the structure of her brain. So her grey matter of her brain actually changes, and the activity increases in that brain, and that's in order to allow her to control her empathy, anxiety, and social interaction, so that she can bond with her baby and feel that protective urge for her baby. So on the most basic level, I guess, these changes are prompted by a flood of hormones during the pregnancy and in the postpartum period, and that's in order for her to be attracted to her baby so she doesn't leave it in a cave or whatever. Has anybody had baby brain? Does anybody have a story to tell about their baby brain? Because I've done some pretty crazy things in my time. And, you know, having cereal out of the fridge is one thing, but sorry, someone's just asked me questions. No worries. I've had a question. I'll just type somebody an answer. Sorry. Just so you know, I am taping this. So if you need to go, by all means, you head off, because we are taping it, and we'll put it on our website so that you can watch it later. Okay, so the interesting thing is about the mum connecting is also that the father, his brain changes too. Now, obviously, that's not to do with the hormones of pregnancy. A man's parental brain is kind of supported by his, well, they call it a socio-cognitive. So basically his connection with the baby, and it grows that way. So the more time he spends with the baby, the more his brain changes. And I thought that was rather interesting too. But that actually makes you a little bit forgetful. It makes you a little bit foggy, a little bit less able to concentrate. So it's a very, very normal part of it as well. Okay, so my next slide is it normal to feel terrible? Well, I've kind of answered that as we've gone along. Absolutely not. I think I see a lot of girls in the clinic, you know, they may not be able to walk properly, or their nausea is so overwhelming, or they are exhausted beyond belief, or there's just so many things that have got out of control that we could actually help them with. So definitely prevention is better than cure. Certainly nutrition is a big one, I think, particularly with what I'm going to talk about next. there's a lot that you can do about that. So getting on to morning sickness. Anybody suffered from morning sickness? Some of you said that you were a bit yucky. So we do a lot of morning sickness, and with really great results as well. So there's been a lot of research to say that acupuncture particularly is a safe and effective treatment for morning sickness. So, that's an option for you as well. Nutrition's the big one. So the key with morning sickness is to try and eat a little bit often rather than trying to eat too much at a time. And also we're wanting to eat foods that calm the nausea down, help balance the hormones, and also are rich in folate, rich in calcium, and rich in magnesium, which can also be the cause of why you're getting the morning sickness. So, for example, folate, which is vitamin B9, it would be really great for you. I'll just give you the top 3 maybe, and they're probably ones that, you would all know are very healthy. So beans, particularly black-eyed beans, the little white ones with the black eyes, when they're cooked, they're fantastic at balancing the hormones and helping with morning sickness. But with morning sickness, you'd probably only feel like a tiny amount, even making it into a broth and then adding some veggies and a few of the beans in as well. Cooked lentils are a really good form of folate, but also help with the hormones. Raw spinach is also good. Avocado is actually great as well, and broccoli. If you don't feel like food at all, I would always suggest that you just get like a broth, a really thin chicken broth if you're not vegetarian, and just pour it over some cooked white rice and just see how you go with that and get your strength back that way. And then hopefully it'll all start to balance out. So dark leafy greens are always going to be a good choice. Chinese cabbage like pak choi or bok choy, whatever you can, and almonds is sometimes a good snack as well when you're suffering from the morning sickness. And also ginger. Ginger's a really good one for some people. Lemon and lime drinks are good, and I always suggest to girls to get a little spoon and scoop up some melons like watermelon, honeydew melon, and put them in the freezer and then eat them almost like ice blocks, because it's quite nice, because quite often you've got a funny taste in your mouth. And rest. It's quite hard to rest. I know it's hard to get time off for something like that. And, when you've got morning sickness, you're at the stage in your pregnancy that you probably haven't told that many people. And it's probably the time when you need the support the most, just like with miscarriage as well. It's the time you don't tell anyone. It's the time when you need the most support. All right, I'm going to hand you over to Faye, and she's going to move into her sort of realm of expertise.
Yeah, so just following on from what Petra was talking about, first of all, I just want to start by saying pregnancy is normal. It's a physiological change in your body. You have emotional changes that happen as well, and all of those things, they're normal. Postural changes, they're normal too. Pain and discomfort, they're not. So sometimes when things are really common, we tend to think that it's normal, but if you're experiencing quite a bit of discomfort or pain, that's not normal. So during pregnancy, your body undergoes quite a major change in a relatively short period of time. Some of these changes are quite obvious, such as the growth in the abdominal region and the altered posture that comes with that. And some of these changes are less obvious, such as the effects of the hormonal release on your body. As your pregnancy progresses, the extra weight in the abdominal area creates a shift in your center of gravity. At the same time, your body is also releasing hormones that will help soften and stretch the ligaments to help your body adapt to the changes that occur with the growth of your baby. So to compensate for the increased load at the front of your body, pregnant mothers will often arch their lower backs and tilt their pelvises forwards. This action helps to maintain the stability and balance, but if too much strain is placed on the muscles and joints of the spine and pelvis, then your abdominal muscles actually become a bit overstretched, and the body will start recruiting muscles in the hip and lower limb to help stabilise whilst walking. This can cause a bit of stress on the pubic bone, and will often result in that waddling-like motion that you can see in pregnant ladies that tend to be in their later stages of pregnancy. As a knock-on effect as well, you'll get changes through other areas of the body. So you have your upper back and shoulders. Your shoulders tend to round inwards a little bit, and your neck tends to push out a bit as your head moves forward as well. So all of those things are compensatory for a few of the changes happening in your body. And again, this is just your body trying to maintain balance and to work with gravity and the changes that are occurring. Next slide. So further down the body, you get extra weight and the fluid retention, as we've touched on before, can widen and flatten. And those of you that have been pregnant before will probably have experienced that your feet can actually change size, because sometimes the ligaments get so stretched that you go up a half size or so in your shoes. If you haven't experienced these changes, I thought we could do a little bit of a exercise if you wanted to, and you can see how your body reacts to them changing. So it's an easy task, but just to be on the safe side, if you do suffer from back pain or you are currently in the later stages of pregnancy, then it's probably best that you skip this exercise. For everyone else, you can just use your common sense, and if you feel discomfort or pain, then you just need to back off a little bit or stop. So pretty easy, really.
Good advice. Yeah.
So I'll give everyone a little bit of a chance to get ready. So I'll find a nice little bit of a space, and first thing you need to do is stand up so that your feet are shoulder width apart and your weight is evenly distributed between both legs. And you can wiggle your toes a little bit, get yourself a little bit balanced. When you're feeling balanced and comfortable, if you look straight ahead and gently tilt your pelvis forward so that both your bottom and stomach are sticking out. So what you will feel now, if you just place your hand on your lower back, you should be able to feel that there's an exaggeration of the curve in your lower back and a little bit of a subtle shift in your center of gravity. You might be feeling a little bit of a strain through those muscles in your lower back, and you might feel like you're a little bit off balance. You may also notice that your toes are gripping the floor a little bit harder than they were previously. You can have a look at your shoulders and neck as well. Are they in the same place as they were before, or are they starting to roll forwards? When I do this exercise, I feel totally out of balance, and it feels very, very odd for my body to be in that position. But it does give you a sense for what pregnant people do go through and what changes can occur and some of the reasons why you might feel a little bit out of sorts on a structural level as well. So for some women, their bodies adapt well to the increase in size and weight that comes with pregnancy.
Yeah.
And most of these women will experience minimal pain and discomfort as their body adjusts adequately to the changes in shape. So they're the people that tell you pregnancy's a breeze, got a beautiful smile on their face. And if you happen to be one of those women that doesn't have your body adapting so well, you probably got the chagrin smile on your face and aren't feeling so perky.
Just suffering through it. Yeah.
That's right. So that's not, necessarily something that you're doing differently than another person. It just means that your body needs perhaps a little bit of help to adapt with those changes. So what's happening is your joints and your muscles are getting a little bit more strain placed on them. So the support for your spine, neck, shoulders, and pelvis isn't adequate for what it needs to be for the increased growth. So this can lead to discomfort or, in some instances, quite significant pain. So that leads me on to talking about some of the common complaints that tend to be related to postural change. So some of the common ones that I see as an osteopath in practice, a large number of patients will come in with all sorts of complaints relating to pregnancy, and the subject matter is far too broad to cover all of them. So I'm just going to focus on the ones that I really see on a day-to-day basis.
Back one?
Yeah, I think so. Yeah.
Yep.
Sorry about that.
Technical glitch. If you've got any questions, by all means, type them in. I know some of you did that exercise and said that it felt really weird. So, yeah, it just shows you, doesn't it? Especially those with the big belly. And I know there's some of you listening to this that do have a big belly.
That's it, keep passing them in. So these three, lower back pain, pelvic pain, and sciatica, I would say the majority of my patients will experience one of these three complaints at some point.
Yeah, I see them too.
Yeah, really common ones.
Does everyone know what sciatica is? Maybe explain. Just
good idea. So sciatica is, in a common terminology, pain down the leg. In a more of a medical, into the buttocks, often down the back. It can go down the side or the front. In a more of a medical sense, it's basically an irritation of the sciatic nerve, which is your major nerve that supplies your whole leg. So your pain can go anywhere down, even into your toes. It can really vary in its presentation. But as a general sense, if someone says to you they've got sciatica, they generally mean they've got a bit of leg pain or buttock pain that's coming from the back usually. So for some people, this will be a bit of a minor niggle, a little bit of a slight discomfort, but generally they can still go about their normal activities. It doesn't really affect their day-to-day living. And for others, the pain or instability with these conditions is so debilitating that it affects every part of their life, and they can really be brought to tears with it.
Yeah.
So that, as what we're saying, isn't normal. We don't want you to be going through that. And there are things that you can do to help prevent that sort of a thing. It's a bit of a common myth that pregnancy hurts, and pregnancy you just have to kind of deal with it because other women do.
Yeah.
But that's really not the case.
And also it's okay to tell people, especially those of you that have, used IVF or been trying for a long time to fall pregnant. You still are allowed to, especially when you come into our clinic, you're allowed to actually say that this doesn't seem right. You don't have to just suffer through stuff. Yeah. And certainly, all the aches and pains, there's quite a lot you can do about it.
Yeah, definitely. So that brings us up to the next slide.
Sorry. Here it comes. There it goes.
So another fairly common one is pain in the neck, shoulders, upper back. So same sort of a scenario as what's happening in the lower body. You have a bit of a strain put on the muscles, bones and joints in the upper body. And as we were talking about in that exercise, your shoulder rolls inwards, your head sort of pokes out to the front a little bit. That tightens up and shortens the muscles at the front of your chest, and the muscles at the back tighten up and overstretch. So that's just your body compensating for this change in posture. And ideally, you want to have a bit of a balance between the front and the back of your chest. So if we can prevent some of that change in posture in terms of your pregnancy as you go down the track, with your pregnancy getting bigger and the gravity effects being greater, if you can help strengthen those areas, that can be really helpful.
And someone's just asked the question, which is a good question. Is this why maybe people can get shortness of breath and carpal tunnel?
Yes, so definitely the case. They're going to be affected with any changes of postures. You can get impingements on the nerves. In the case of like a carpal tunnel syndrome, there's a bit of a blockage in the
So that's along the hand, isn't it, and the wrist, and
that's right.
All numb and tingles and can be quite
pretty common,
pretty painful.
You can get pain in the hands, you get a numb feeling often at night, and the shortness of breath, that certainly can change obviously with the baby growing and pressing up into the ribs and the diaphragm.
Yeah.
But as you can imagine yourself, if you bend over, your actual breath doesn't expand quite as easily.
Yeah.
The other really quite common complaint that comes into my practice is headaches in pregnancy. This is probably something that isn't talked about as often.
Yeah.
So I thought it would be a good one to talk about. Definitely you have hormonal changes, which are often the culprit in these changes. It's a lot for your body to deal with. So they can be the cause of headaches. But there's also physiological changes that occur. So you do want to have a look at, again, structural side of things. Is your neck pain or is your lower back pain stacking up and causing a headache that comes from that area? Is your headache related to fatigue, physical or emotional stress? Lots of people experience that when they're pregnant. Sinus congestion and allergies is another common one that comes on. Your immunity really takes a bit of a dip when you're pregnant. A lot of the nutrients are heading off to the baby, which is where you want it to be, but that does take a bit of a toll on the mum as well. And, of course, any combination of these can cause a bit of a headache. The other thing is migraine headaches. For the most part, people that do suffer migraine headaches actually tend to find that their headaches improve when they're pregnant. Part of the reason for this is migraines are thought to be caused by abnormal functioning in the blood vessels of the brain, and with the increased blood flow moving into the tissues, there's thought to be less spasming when pregnant. So if you are a sufferer of migraine, often they're less severe when you're pregnant.
Has anyone else found that in their pregnancy, that things have improved rather than got worse? Because that's always nice to hear too.
Absolutely. I've had quite a few patients that have reported that with their migraines improving. So it certainly can happen.
Yeah, great. Yeah, one girl's just said, I used to get migraines, and then severe headaches, and and another one has just said that she's only had one in the last 3 months. How many weeks are you? The one that just said that 14 plus 3, aren't you? 14 weeks plus 3 days. Yeah. So that's good. Yeah, I'm very pleased to hear that.
That's excellent. Most of your headaches that do occur in pregnancy tend to be in the first trimester, which is often attributed to the hormonal headaches, and the third trimester, which tends to be more those spinal and postural changes.
Yeah. The other thing that headaches and migraines can be attributed to, like everything can, is stress and trying to do too much when you're pregnant as well. So it can be a sign for you to kind of slow down a bit as well. So if you've made changes in that way and the headaches improve, then there's a pretty good chance that you're your body's feeling less stressed. So stop screaming at you.
Well, that's it. It's a huge one when it comes to it. And the other thing I should mention is, whilst most headaches are normal physiological changes, some headaches can be a sign that something more serious is going on.
Yeah.
So if you do experience, for instance, blurred vision, vomiting, pain in your upper abdomen, sudden swelling of the face, hands or feet, then you do need to see your doctor, as these signs can be associated with a condition called preeclampsia, which is a serious condition that needs to be monitored closely.
And touching on the preeclampsia, I will go over it slightly at the end. We've all kind of heard of it, and we all know it's a bit scary, and we all know we don't want it, but really they don't know what causes it in Western medicine. So it's a rise in blood pressure, a rise in fluid, and then it systems start to shut down, and that's really dangerous for the mum and for the baby. So that's why whenever you get anything that could be to do with increased blood pressure and increased fluid, it's like red rag. Yeah. So that's why we all go, you've got to go and get it checked. But it's one of those things. Keep your blood pressure down, and preeclampsia won't come.
And definitely tell your practitioner if you are noticing those experiences changes, because they're important to know.
But it is quite rare, preeclampsia. Quite rare. Yeah. Well, certainly in our clinic it is.
Absolutely.
Right.
So we touched on stress. I think if you spoke to most pregnant people and their families, they'll definitely put stress as one of the the main factors that they've noticed being pregnant.
It's a trigger for problems too, isn't it? A trigger for issues.
Absolutely. Yeah. It's often that underlying factor that just sometimes can make what would normally be an easy to handle situation or issue just that much more difficult. So it's a special time for parents being pregnant, that, as we're saying, it can be a very, very stressful period in your life. So there are many different types of anxiety that women may experience in pregnancy, and many of them will actually experience anxiety and depression at the same time. So it's natural to be a bit of a worrywart, and your hormonal changes will certainly play their part in that. So you may find you start fretting over whether you're eating the right food, whether you're drinking enough water, are you getting enough rest. It's also normal to worry about whether your baby is healthy, what sort of parent you will be, what changes will happen in your current life once the new baby arrives.
Feel free to write down any worries that you've had, because these are all really, it is, as you say, as special as the pregnancy is and as fantastic as it is and how exciting it is, it brings a whole new life to you, really. It brings a whole new kind of basket of worries.
Definitely.
Yeah. So if there's anything that's worrying you in particular that you'd like to share, then absolutely, somebody else is probably feeling the same way, to be honest.
Yeah. And that's it. I think whatever the case or whatever it is the cause for your particular worry, if you have someone, whether it's a partner or your local your GP or your other healthcare practitioner or even a close friend, if you have someone that you feel like you can talk to about that, you often feel a lot better. And if you do need to have a bit more of a chat to someone, that person can often help point you in the right direction.
Yeah, because there's some really good systems set up now. There's a few good places in Geelong. If I think most of you are from the Geelong area.
Yep.
That we can actually, tell you about if you need a bit of support. And it's okay. It's okay to be not okay. That's kind of, it's as joyful as you are doesn't mean it doesn't come with its concerns. Yeah.
No, that's a big one. So how do you know when those worries sort of develop into something that's a little bit more? Which this can be a bit of a tricky question to answer. Many of the indicators for anxiety and depression overlap with symptoms that are commonly attributed to pregnancy itself. So some of those are changes in your appetite, changes in your energy levels, lack of concentration, or changes in your sleeping patterns.
Yeah, like insomnia is a big one, I think, and it's particularly once you've had the baby and the baby's sleeping and you're not. I reckon that's a bit of a sign. If you're not able to sleep even though your baby's asleep, this is at night, then that can be a bit of a trigger.
Absolutely.
A bit of a sign, sorry.
Yep. And that's a good point there. In terms of your anxiety, your stress, and depression, these things are things that can really carry on after you've had the baby. A lot of your physiological stuff goes back to normal quite quickly. Your body can regain its shape quite quickly. But some of the things that have changed in other areas are actually, they tend to stick around a little bit longer. So some of these things can certainly pass over into other areas of your life. So the same sort of advice applies for that as well. If you have someone to talk to, that would be very good. So as a bit of a guide to help if you're worried for yourself or for someone else, divided it up into sort of 3 key areas that anxiety or depression may present itself in. So the first one is in your body. So you might experience tightness in your chest, difficulty breathing. You might have a sore stomach or the butterflies in your stomach. You might find you have a loss of appetite. You could find muscle tension or just a sense of heart palpitations or that racing heart sort of a feeling. You might find yourself just feeling a bit shaky even.
A bit racy.
Yeah.
Some girls say it, they just feel racy.
Definitely. So they're little things to look out for. The next one is in your mind. So in this way, it will present itself about perhaps envisioning the worst case scenario, or you're finding yourself more irritable. Some people experience panic attacks. Other people find that they're obsessively worrying about things that they didn't used to worry about. Some people find that they feel useless, or they have thoughts that they're going to be useless as a parent. So it can be a projection onto a future event. And again, just those racing thoughts where you can't seem to calm your mind. So that can be all sorts of ways those present it.
Yeah, and one of you just said that someone that she knows had worries about setting boundaries about being visited in hospital. She wanted to be able to rest, and putting those into place is really important if you're able to. By setting boundaries, you're creating some space for you to be a mum and to learn what you need to learn. So, yeah, it's valid. And if this person's obviously talked to the girl that's logged on here about her concerns, and that's probably halved her concerns. And I'm sure this person gave her really good advice about how to create those boundaries. So, yeah, good. Thanks for that.
Yeah, preparation's a big thing, I think.
But sometimes you don't know what you don't know, right?
Yeah.
So, it's great that you've got someone to talk to that maybe does know a little bit more and can help you through it. Yeah.
Yeah. So the third one is in your behaviour or actions. So you may find yourself avoiding certain situations, certain people, certain activities, or certain places. You might find that you have a need to over-control a situation. You perhaps need to micromanage something or be involved in decisions that normally wouldn't bother you. Other people find that they're constantly seeking reassurance.
That's a common one, isn't it?
Definitely. Yeah. And particularly when you talk to the partner of the pregnant lady, that's a common one that they bring up themselves.
Well, they also say, I can't do anything right. It doesn't matter what I say.
Absolutely.
She's not feeling like I'm giving her what she needs. Yeah.
Yeah. And often the person themselves doesn't know what they want. They want reassurance, but they don't actually know what they feel like they need or what they want.
Yeah. I'm sure some of you have had that with your partners, even if you're not pregnant yet. I'm sure there's times when you feel like there's nothing that they can do that's going to be right. Yeah.
That's right. And the other big thing to look out for in behaviour actions changes is just being excessively careful around perceived dangers. So again, it's probably natural when you become pregnant to be a little bit more cautious about things. There's certain foods that you don't want to eat, like soft cheeses, and then there's perhaps things that in your perception are quite dangerous, which you're perhaps perfectly capable of doing. So in some cases, people will feel like they just can't leave the house because they might be in danger, or their baby might be in danger. So it's a tricky one to work out where your thoughts are at in that way. But if you feel like you're changed in your perceived changes, then that's a bit of an indicator that something else might be going on. Yeah. You might be having a bit of anxiety underneath all of that.
All right. So there's a few other little conditions that I just thought I'd touch on. By all means, it's probably something most of you know about, or you would know somebody that has had them. So fluid retention is the one where you get sort of edema or swelling. It is normal to have extra fluid in pregnancy, but it shouldn't be to excess. So there's quite a few ways of avoiding that, and that's what that pitch is about. It's not just saying I'm going on holidays to Mauritius soon. It's saying that, it's really good to actually physically get your feet up. Fluid retention, as you've heard previously, is one of those symptoms that can be linked to preeclampsia. So we don't want you becoming more likely to get it just because you've got too much fluid. So get your feet up, and I mean actually literally level with your heart or a little bit higher. So even if it means at lunchtimes you have to go out to your car, this just brings back memories, go out to your car and put your feet up on, the dash or something like that, just even if it's just for 10, 15 minutes. Ideally, by the time you get to your third trimester, you'd be doing that sort of 3 times a day. So if that means, sorry, the birds are singing away. if that means that you have to maybe finish work a little bit earlier because you've got too much fluid, then absolutely you should, because it's really important to keep that fluid. Another really good option, I think, is massage, pregnancy massage. So it's a really good way to keep it under control as well and get that fluid back into circulation and out of the body. Heartburn and reflux, that's a really common one, whether you're pregnant or not. It's particularly common in, I'd say, the third trimester. Oh, and someone else has talked about varicose veins in her legs and her vulva, which is really uncomfortable, and no one ever talks about them, especially if they're around the vulva, because it's, quite a personal place to have them. Very similar to what I was saying about the fluid retention. You just have to get those legs up. It tends to be, I don't know whether you agree, Faye, but it tends to be a genetic link to that, and it's all that extra blood and fluid that's going through your body, and it makes the veins, I don't know, some people may not know what they are, and the person that wrote that in could probably explain it a little bit better than me, but it just means that the veins in particular areas become hyperextended, and there's just too much fluid in them. They become bulky, they come up to the surface, and they're almost like big sort of ropes almost, and quite painful at times. So I've had limited success. I don't know, how about you with the varicose veins?
I've had quite good success with it. Essentially, your veins don't have their own muscle tone to the extent that your arteries do.
And so all that blood,
Yeah, so it's basically like filling up a pool, and when you're standing up, your blood's going to pool into your legs.
Yeah.
So if you can get a bit of muscle relaxing through the pelvis, where a lot of the blood from your legs drains up into, that can help open up the pathways a little bit.
Yeah, and help with the flow. And magnesium-rich foods seem to help. And vitamin C would be a good choice.
And
or vitamin C-rich foods or supplements.
On magnesium there, another common thing with pregnancy is restless legs.
Oh, yeah. So, we do a lot of that. Yeah.
And magnesium is very, very
That's
good
where
for
your
helping.
legs feel like, particularly at night, it tends to be more in the afternoon and night, and it feels like your legs just have to keep moving.
Yes.
So hopefully no one suffered from that, because that's just pretty horrible. But, yeah, there's ways of treating that. So heartburn and reflux, just quickly, is a common one. It's caused by the valve at the top of your stomach relaxing due to the progesterone. A lot of people don't get it, but unfortunately quite a few do. I find acupuncture works beautifully for it, and very, very rarely would I have a patient that needs to take heartburn or reflux medication, which is great. But there's things you can do at home as well. Small amounts of food often take time. Make sure you've got enough time after your meal to be sitting up and let it digest a bit before you're going to bed. So, maybe it means eating dinner a little bit earlier. Sleeping on 2 pillows can help, but I find acupuncture, and I would say osteo would help heaps as well. So there's lots of choices with that, but it is uncomfortable, and it does happen because the progesterone has relaxed the valve, but also the baby is, especially in the third trimester, is pushing up and putting some physical pressure on the esophagus, on the stomach as well, and pushing the gastric juices up. So hopefully no one's getting that. Hemorrhoids is another one that's a bit embarrassing. It just means that, again, we've got a little bit of a protrusion coming through the anus. Usually it's from suffering constipation, and it's just from straining, and then we get a little bit of, what is it?
Inflammation of the blood vessels.
It's just inflammation of the tissue almost, isn't it, around the anus?
Yeah.
And it's very... Well, more so it's embarrassing when you have to tell somebody. They give you hemorrhoid creams, but I find we can raise the energy up and fix that pretty easily as well. The big thing to avoid hemorrhoids is nutrition, keeping up your fibre, keeping, the bowels working so that they're not too hard to pass. Constipation is such a common issue in pregnancy too. But again, I honestly think that you could probably treat that most of the time with pretty good nutrition and plenty of fluid as well. Yeah, and there's probably, other ways of doing it. So less common conditions, we've touched on the varicose vein, so I won't double up on that. You can see from the image that I've put, there's placenta previa. You've probably heard of that. Hopefully you haven't had it. It's not life-threatening, but it means that you can see from the picture we've got a normal placental attachment where the placenta's out of the way of the cervix. The cervix is where the baby actually comes out. So the cervix opens and that's how your baby's going to be born. But when the placenta gets in the way, so this one's a complete one. There's also ones that are called partial, where it's partially covering the exit, and usually they move out of the way. But when it's complete, there's not many options. They have to do a cesarean for you. Otherwise, the baby can't get out, plus you'd probably hemorrhage. So that's why they do have to ultrasound. I don't believe in too many ultrasounds, but certainly the 19-20 week one is where they would be looking for that. And preeclampsia we touched on as well, which is where the blood pressure goes up. There's too much fluid in the body. You get all those symptoms that Faye said, and it's kind of panic mode if that starts to happen, because eclampsia is when things start to shut down. Again, it's avoidable. I think keep your blood pressure down, take your rest, do your nutrition, take time out when you need it. That's a really good way. If work's stressing you out too much, you need to maybe start working part-time. I know we're not all made of money, but it's really important to keep that blood pressure down. Your body will give you signs and symptoms before it becomes preeclampsia, so we just have to listen to that. Okay, so when your baby is near or here, in the clinic we do quite a lot of natural labour inductions. Generally we sort of start to prepare you for labour, 4 weeks out. Yes, Faye's probably very similar. Just starting to soften and, work on baby's position. It's really, look at that cute baby, melts my heart. Head down, try and make sure Bubs is not breech, make sure it's in a good position and help, strengthen the muscles so that and increase the blood flow to the muscles so that you're ready for good, strong, clean contractions and a really clean kind of exit. That's all we want to do. We want the pelvis to open and Bubs to come out, be in the right position, and it'll be as good as it can possibly be. Mastitis is something that pops up quite a bit too. It's generally, I find most people that I see don't get mastitis, but I know it is very common. And there is things we can do. There's herbs and there's acupuncture, and there's a lot that Faye can do with lymphatic drainage. It's blocked ducts on the breast, and they can get infected. So I'll just make sure nobody's asking me some questions while I'm flying through this. No, good. And the other big one is postnatal depression. So the signs and symptoms that Faye was talking about with anxiety can happen during your pregnancy or after your pregnancy. Either way, it's just as concerning. I find maybe with the postnatal depression, quite a bit goes undiagnosed because you just feel like it's normal. So that's why those signs and symptoms that Faye gave you is a really good double check on yourself. Am I able to sleep when the baby is sleeping? Am I getting heart palpitations? Am I getting shortness of breath? Am I feeling hungry? Am I obsessing a bit much about if the baby's hot, the baby's cold, the baby's, asleep or not asleep, or, it's okay. You're going to naturally worry about these things. That's all normal and part of being a parent, but it's whether or not you feel like it's getting a bit obsessive, but particularly the anxiety, not feeling like you're able, I think you should stay home a lot with a little baby anyway, but, not feeling like you want to talk to anybody else, not feeling like you want to get out of bed, things like that can come up. I find it's more an anxiety. They shouldn't probably call it postnatal depression. I would call it postnatal anxiety. That's how I find it presents most often, and I feel like I probably had that after my first, particularly, where I would just lie in bed and overthink things the whole time. My head was racing, trying to think, what else can I do? What else do I need to do? Yeah, so just keep an eye on yourself and have a chat to your partner and get them to keep an eye on you as well. Do a little bit of research while you're pregnant, and certainly when you're, after you're pregnant, hopefully you're on top of it right from the start. So basically what we're wanting to say to you is that there are ways to create an optimal pregnancy. Yeah, some things will pop up, but there's always someone that can help you with it generally, as long as you tell someone and source out some people that can help you. And that's obviously what we're trying to do, is to give you some choices. So there's natural medicine choices. I mentioned pregnancy massage. I've mentioned quite a lot about nutrition. Obviously we've talked about osteopathy. Obviously, I do Chinese medicine, which is acupuncture and Chinese herbs. Let food be thy medicine. There's quite a lot that you can treat using your food. Everybody has to eat. Ask for help. That's a really big one as well. So if your friend says, oh, look, I really want to cook you a meal, and just say yes. Always say yes. Never say no. Never say no to help, but say no. It's okay to say no to going out. It's okay to say no to somebody that wants to have a coffee. It's okay to say no to somebody that wants to come down and stay for 6 hours. It's okay to say no to a lot of things, but it's not okay to say no to help, because people genuinely want to help you, and it makes them happy to feel like they help. And control what sort of help you want as well. So I would always say if they can drop around a basket full of fresh, organic, preferably food, then I'd say, oh, please do. And if they need to leave it at the door, tell them to leave it at the door. That's all good as well. Rest and relaxation is a big one. We are a fairly fast-paced society. We feel like we've got to go, go, go. And quite often when we've had the baby, we're pushed to kind of get out and about and feel like we know everything and go to mother's group and take the babies to the shopping centre. I honestly think it's really important to have some time at home. In China, it's very expected that you stay at home for 3 months and your family just bring you 3 meals a day, and they take your washing away and bring it back. We don't have that luxury here. There is a reason for them doing it, not only to nourish the mum to help with the breastfeeding, but it's also to not overstimulate your baby. There's a lot of research to say by doing that, that's going to be calmer mum, calmer bubs and all that. Exercise, during your pregnancy to within your comfort zone and to what you feel comfortable doing. So I've just written yoga, Pilates, swimming are all quite good choices, aren't they?
Getting in the water is great, even if you don't feel like swimming, if you can get in and walk in the water. So if you are having any of those sort of symptoms where weight bearing just feels a bit painful or awkward, actually walking through the water can be really helpful for releasing a bit of strain.
Yeah, and especially in the ocean, because you don't have to worry about chlorine there either. So the ocean's a really good choice. And be a little bit mindful, take some breaths, focus on how you're feeling at that present moment, and just sort of, reconnect with yourself and your baby is always a really good choice too. And I've written down there, trust your natural animal instincts. So our instinct as a parent is to protect our child, and that's fairly instinctive right from the start. So just listen to that. So when I said about saying it's okay to say no to things, then, if something doesn't feel right, then, it probably isn't. So trust that, because you're not only protecting yourself, but also this little baby that's to come. So I want to say thank you for your time. If you've got any feedback, of course, let us know. We will email you once I've worked out how to download the recording of this. We will send you a copy, but as I said, we will put it on our website for you as well if you'd like to go back over anything at all. So thank you for your time, and we hope we can welcome you to our clinic one day if you haven't been there already.
Thank you. Thanks for joining us.
Good night.
Night.